Have you ever brushed off a lingering itch, thinking it's just dry skin, only to wonder later if it could mean something far more serious? What if that subtle irritation, especially in older adults over 60, is actually your body's quiet cry for help? And what if spotting it early could save your health, or even your life? For older adults, unexplained itching in specific areas of the body can sometimes be an early warning sign of a serious condition like cancer, long before other symptoms appear. In this video, I'll reveal 5 exact itchy spots that could signal deeper issues, supported by real stories and medical insights. You'll learn how to tell the difference between harmless and concerning itches, and what steps to take to protect your health. Recognizing these signs early could make all the difference. Sign 1. Persistent itching on the lower legs. For seniors, an ongoing itch on the lower legs, particularly the shins and calves, might seem like a minor annoyance, easily blamed on aging skin, weather changes, or even a new pair of socks. But if the itch persists without a rash, dryness, or obvious trigger like new soap or detergent, it could be more than just a skin issue. This symptom has been increasingly linked to blood-related cancers, especially lymphomas such as Hodgkin's lymphoma. Unlike the fleeting itch caused by dryness, this one is relentless, often intensifying at night and resisting typical remedies like moisturizers or antihistamines. The reason lies in the complex interaction between cancer and the immune system. Lymphomas develop in the lymphatic system, a vital part of your body's defense network. As cancerous lymphocytes multiply, they release inflammatory chemicals called cytokines into the bloodstream. These cytokines can irritate nerve endings deep beneath the skin, causing a profound, sometimes burning itch that feels as though it comes from within rather than on the surface. The lower legs, with their dense network of sensory nerves and relatively thin skin, are especially prone to this phenomenon, making them a common location for this symptom. Take the case of George, a 75-year-old retiree who shared his story at a community cancer awareness seminar. For nearly 6 months, his only complaint was a relentless itch on the fronts of his legs. At first, he dismissed it as just another quirk of aging, or perhaps a reaction to new laundry detergent. His primary care doctor also saw nothing alarming and prescribed a steroid cream for suspected eczema. But the itch persisted, growing worse at night and disrupting his sleep. It wasn't until routine blood work showed elevated white blood cell counts, followed by imaging that revealed enlarged lymph nodes in his chest, that George was diagnosed with Hodgkin's lymphoma. Looking back, he realized that the itch had been his body's earliest, and for months only, warning sign. This pattern is not rare. While not every itch points to cancer, the key difference here is persistence and resistance to treatment. Unlike common irritations caused by dryness, allergies, or external factors, this itch offers no visible clues, such as redness or flaking, making it easy to overlook, especially for older adults. In older adults, the body doesn't always signal distress as clearly as it does in younger people. This subtlety matters. Aging can dull the body's ability to show obvious symptoms. Pain may be absent, and lumps may be too deep to feel in the early stages. Yet, the nerves remain sensitive, and a persistent itch can be an early whisper of trouble. If the itching comes with other quiet warning signs, such as night sweats, unexplained fatigue, unintentional weight loss, or swollen lymph nodes, it's time to see a healthcare provider. Ask for a thorough evaluation, including blood tests like a complete blood count, CBC, or imaging studies, to rule out hidden conditions. The body often speaks in whispers, and for older adults, paying attention can be life-saving. Sign 2. Itching between the shoulder blades or upper back. Another subtle but potentially serious symptom is a persistent itch in the upper back, especially between the shoulder blades. Many seniors dismiss it as dry skin, poor posture, or an annoying clothing tag. But when the itch feels deep, almost as if it's coming from beneath the skin, and refuses to go away despite creams or lotions. It may signal something far more serious, such as pancreatic cancer. What's remarkable is that this itch can appear months before classic pancreatic cancer symptoms like abdominal pain, jaundice, or digestive issues. The connection may seem puzzling, given the pancreas is located deep in the abdomen. However, the link lies in how tumors can block the bile ducts, which carry bile from the liver to the intestines. When these ducts are obstructed, bile salts build up in the bloodstream, a condition called cholestasis. These bile salts can deposit in the skin, especially in areas dense with sensory nerves like the upper back, causing a deep, nagging itch that feels internal rather than on the surface, often described as a phantom sensation. This deep, phantom-like sensation often resists all attempts at relief. Take the case of Linda, a 70-year-old grandmother who endured this exact symptom for months. Night after night, an itch between her shoulder blades woke her from sleep. She tried moisturizers, antihistamines, even replacing her mattress and bedding. Yet nothing eased it. She described it as feeling like it was coming from inside my body. During a visit to her doctor for unrelated fatigue, routine blood work showed elevated liver enzymes, prompting further investigation. An abdominal CT scan revealed a small tumor in the head of her pancreas pressing on the bile duct. At the time, Linda had no pain, no jaundice, and no digestive issues, only that stubborn itch. Reporting it early led to a diagnosis at a stage when treatment was still possible. This type of itch is very different from ordinary back irritation caused by dry skin or friction. It is highly localized, often centered between the shoulder blades, and refuses to improve with standard treatments. For older adults, who may hesitate to mention what seems like a small problem, this specificity matters. Additional signs such as dark urine, pale stools, unexplained weight loss, or persistent fatigue should raise immediate concern. If you or someone you love experiences this deep, persistent itch, especially if paired with these other symptoms, see a doctor promptly. Ask for liver function tests and consider imaging, such as an ultrasound or CT scan, to check for internal causes. The upper back, though far from the pancreas, can be an unlikely messenger. Listening to its signal could make a critical difference. Sign 3. Itchy scalp without visible flakes or dandruff. An itchy scalp is a common complaint, often blamed on dry air, harsh shampoos, or aging skin, particularly in older adults. However, when scalp itching persists without visible signs like dandruff, redness, or flaking, and instead feels like tingling, crawling, or burning, it may point to something deeper. In some cases, this symptom has been linked to blood-related cancers, such as leukemia, or even skin cancers affecting the scalp. For those over 60, whose skin and immune systems naturally change with age, this kind of itch can be an early clue to an underlying problem. What makes it distinct is its resistance to common remedies. Unlike irritation from dryness or product sensitivity, this itch often feels neurological, described as prickling or burning that shifts across the scalp, persisting despite moisturizing oils, anti-dandruff shampoos, or lifestyle adjustments. In chronic lymphocytic leukemia, CLL, the cause may be abnormal immune activity. As leukemia cells multiply in the blood or bone marrow, they trigger systemic inflammation, releasing chemicals that irritate nerve endings in the skin. The scalp, with its dense network of sensory nerves, is especially vulnerable. Henry, a 73-year-old retired teacher, experienced this firsthand. For months, an odd itch struck his scalp every afternoon like clockwork. At first, he blamed his shampoo or his favorite wool cap. He switched to hypoallergenic products and stopped wearing hats. Yet the itch remained, a crawling sensation no scratching could relieve. During a routine checkup for growing fatigue, blood tests revealed elevated white blood cell levels, and a bone marrow biopsy confirmed early-stage CLL. For Henry, that itch was the body's first, and for a time, only, warning. Beyond leukemia, persistent scalp itching can also signal skin cancers like basal cell carcinoma or squamous cell carcinoma, particularly in older adults with thinning hair or sun-exposed scalps. These may appear as small, itchy patches. These patches may resemble dry skin or mild irritation, yet they fail to heal, often because the scalp is difficult to examine on your own. Without help, these changes can easily go unnoticed. Regular checks by a partner, caregiver, or hairdresser, ideally under good lighting, can be invaluable for spotting suspicious areas. For older adults, the challenge is telling this itch apart from normal age-related changes. While dryness and sensitivity are common, a cancer-related itch stands out for its persistence, intensity, and resistance to treatment. If the itch lingers for weeks, feels unusual, or comes with other symptoms, such as fatigue, easy bruising, frequent infections, or unexplained weight loss, it's time to act. Consult a healthcare provider and request a thorough evaluation, including blood tests. If there's concern about skin cancer, ask for a referral to a dermatologist for a scalp exam or biopsy. Using tools like dermoscopy, a dermatologist can detect changes that might otherwise be missed. The scalp, though often overlooked, can be a powerful messenger if we choose to listen. Sign 4. Localized itching on the chest or breast area. For seniors, especially those in their 60s, 70s, and beyond, a persistent itch on the chest or breast, particularly around the nipple or beneath the breast, can seem like a minor irritation at first. It's easy to blame it on sweat from a warm day, chafing from a tight shirt, a reaction to laundry detergent, or simply the thinning skin that comes with age. Yet, this area is one of the most overlooked when it comes to detecting symptoms of more serious issues, such as inflammatory breast cancer, other breast cancers, or tumors near the chest wall. What makes this symptom unique is its subtlety and its tendency to appear before more obvious signs like a lump. The itch is often localized, staying in one spot rather than spreading, and the skin in that area may feel unusually warm, irritated, or even tight. Sometimes the skin may look slightly rough, feel thicker than surrounding tissue, or show a reddish or pinkish discoloration that doesn't fade. But just as often, there's nothing to see at all, only an unrelenting itch that refuses to improve despite creams, lotions, or changes in clothing and hygiene. Take the case of Ruth, a 69-year-old retiree who noticed an unusual itch around her right breast. At first, she thought it was a minor irritation from her bra's underwire or a reaction to laundry detergent. She switched to softer fabrics, used hypoallergenic soaps, and even went without a bra for days, assuming friction was the cause. Yet the itch persisted, always in the same spot, sometimes worse at night. Weeks later, during a routine checkup, Ruth mentioned it almost in passing. Her doctor, not taking any chances, examined the area and spotted subtle dimpling in the skin near the itch, a potential red flag. Imaging and a biopsy revealed a small but aggressive tumor just beneath the skin, one that didn't appear as the typical round lump many expect with breast cancer. Ruth's early detection likely saved her life, but her experience shows how easily such a symptom can be overlooked. Inflammatory breast cancer, in particular, is a rare but aggressive form that often defies the usual patterns. Instead of forming a distinct lump, it can cause diffuse changes in the breast tissue, sometimes mimicking an infection or rash. The itch may be one of the earliest signs, often accompanied by warmth, swelling, or a heavy sensation in the breast. Because it progresses rapidly, early recognition is vital. While this type of cancer makes up only 1 to 5% of breast cancer cases, its speed makes it disproportionately deadly if not caught in time. For men, the risk is even more easily missed, as male breast cancer, though rare. Male breast cancer accounts for less than 1% of all breast cancer cases, yet it remains a real concern, particularly for men over 60. Many men never think to monitor their chest for changes, and an itchy patch near the nipple, a small, thickened, or scaly area, or a vague discomfort beneath the chest muscle, can be brushed off as unimportant. But these may be early warning signs. Just like women, men can also develop skin changes, such as redness, dimpling, or even nipple inversion, all of which require prompt medical evaluation. Persistent itching in the chest or breast area isn't always about breast cancer. It can also signal other serious conditions. Enlarged lymph nodes in the armpit or near the collarbone, for example, may point to lymphoma or another malignancy pressing on nearby tissues, causing irritation or inflammation. Sometimes the itch is paired with subtle swelling, a feeling of fullness, or a faint ache that's hard to locate. These signs are often so mild they're ignored, yet they can be the body's quiet warning that something is wrong. The key takeaway is this: if you have an itch in the chest or breast area that lasts for weeks, stays in one spot, and doesn't improve with moisturizers or antihistamines, seek medical advice. Early detection of serious conditions like cancer doesn't always depend on advanced scans or complex tests. It often starts with noticing the body's subtle cues. Your skin may not speak, but it can signal distress in ways you cannot afford to overlook. Sign 5. Persistent itching in the anal or genital area. Few symptoms are as uncomfortable or as often dismissed as ongoing itching in the anal or genital region. For older adults, especially those over 60, this can be an awkward topic, often ignored out of embarrassment or the belief that it's nothing serious. It's easy to attribute it to. Common causes include poor hygiene, irritation from rough toilet paper, friction from clothing, reactions to soaps or incontinence products, or minor infections like yeast overgrowth. And often, these are indeed to blame. But when itching lasts for weeks or months, returning relentlessly despite careful hygiene, topical treatments, or lifestyle adjustments, it could be an early warning sign of something far more serious, such as anal, vulvar, or penile cancer. What makes this symptom so deceptive is how easily it passes for something trivial. It may begin subtly, noticeable only at certain times of day or after specific activities, like sitting for long periods. Over time, however, it becomes constant, sometimes intensifying into a raw or burning sensation that feels deeper than surface irritation. The skin may change texture, becoming rougher, thinner, or slightly discolored, reddish, whitish, or darker than normal. In some cases, there are no visible changes at all, only an itch that refuses to go away, no matter the cream, powder, or care applied. Consider Eugene, a 76-year-old widower who spent nearly a year battling what he believed was hemorrhoid-related discomfort. He tried everything: over-the-counter creams, dietary changes, sitz baths, even cold compresses, but the itch in his anal area persisted, always in the same spot, sometimes waking him at night. Frustrated, he finally saw a colorectal specialist. A scope exam revealed a small lesion on the anal canal wall, and a biopsy confirmed early-stage anal cancer, a rare but treatable condition when caught early. Eugene's story is a reminder of how easily this kind of symptom can be misattributed, and how important it is to trust your instincts when something feels persistently off. For women, vulvar cancer, though rare, with about 6,000 cases diagnosed annually in the US, is another concern, particularly for those over 60. One of its earliest signs is a chronic itch in. Vulvar cancer can begin with an itch in or near the vulva, often without any visible lump. The skin may feel rougher or more fragile, sometimes with subtle discoloration or small sores that don't heal. Many women attribute these symptoms to postmenopausal dryness, hormonal changes, or irritation from pads or underwear, delaying medical attention. But a relentless itch, especially if it worsens at night or stays in one specific area, should never be ignored. Similarly, penile cancer, though exceedingly rare, about 2,000 cases per year in the US, can present with persistent itching or irritation, particularly around the glands or foreskin. Men may dismiss it as a minor irritation or infection, but if it lingers despite treatment, it needs a closer look. The anal and genital regions are packed with nerve endings, making them highly sensitive to internal changes. Persistent itching here can indicate not only local cancers, but also inflamed or enlarged lymph nodes in the groin, which may suggest lymphoma or metastatic spread from another cancer. Sometimes the itch comes with subtle signs: pressure, slight swelling, or changes in bowel or urinary habits. These symptoms can be so mild and even intermittent that they're easily overlooked. The greatest barrier to addressing this issue is hesitation. Many older adults feel embarrassed to discuss such a personal matter, worried they'll be seen as overreacting or wasting a doctor's time. But silence is far more dangerous than discomfort. Speaking up about a chronic itch in the anal or genital area could lead to early detection, improving treatment outcomes, and offering peace of mind. The rule is simple. If the itch lasts for weeks, resists standard treatments, and feels localized or unusually intense, don't assume it's normal. Make an appointment with a healthcare provider, whether it's your primary doctor, a dermatologist, or a colorectal or gynecologic specialist. Early detection often starts with noticing the body's smallest signals and having the courage to act. Thank you for watching this video on the 5 specific itchy spots that could signal something serious, including cancer, and how to recognize when your body is sending a warning. Our bodies are always speaking to us, and sometimes it's the small, stubborn signs, like a persistent itch, that carry the most important message. My hope is that this has encouraged you to pay attention to those quiet signals and take action when something feels off. What is one thing you've learned from this video, and how will you apply it in your life? Share your thoughts in the comments below. Your experience could inspire someone else. If you found this information helpful, don't forget to like, share, and subscribe for more health insights designed to inform and empower you. Wishing you good health, happiness, and peace. And remember to subscribe to my channel, Healthy Aging Blueprint.